Yeah, I don't. Well, I mean, it's. Yeah.
All right.
Gonna snap a couple photos for each other.
Is labor in the house? Is labor in the house? There we go. We wanted to make sure this mic was working.
Stay right here. Maurice should be running this thing. So my name is Todd Hobler. I'm the Executive Vice President of 1199 Upstate. And I wanted to welcome all of you here to this event that's very important that everyone is here. I was asked to sort of frame the issue. It's pretty basic, right? Western New York healthcare has been underfunded and under-resourced for a long time. We've seen multiple hospitals, nursing homes close over the years. We've seen service lines and layoffs happening right now. Our folks who are doing the work are overworked and understaffed. Recruitment and retention is a problem. And all of this affects patient care, right? And then on top of that, the federal government just passed a budget, GOP Congress, and Trump signed it July 4th, that cuts $1.8 trillion from healthcare, right? To fund tax cuts for the wealthy, mass deportation, and fund the Department of War, right? Question about priorities. The fact is that we are now healthcare in Western New York in a code red, right? It was bad to begin with. And now these cuts threaten the healthcare of hundreds of thousands of Western New Yorkers, right? We are here today to say that the state needs to step up and step in. We're not going to let the GOP Congress off the hook, but we need in this budget cycle, New York State to fund healthcare in a way that provides good quality, accessible healthcare to every Western New Yorker. So with that, I'm going to turn it over to the Reverend, who's going to lead us in a prayer. Thank you.
Siblings, let us pray. O God of the forsaken and oppressed, by the power of your Spirit today, our advocate, our fellowship, our comfort. Please give us the words that challenge injustice, expose systems that exploit and kill. May these words be coupled with action that is good news for the marginalized and disturbs comfortable religious practice. A living and active word that pleads on behalf of those unnamed and unknown, and at times made known to us tragically through our news feed. Data of neglect to care for all of our neighbors. So we lift up the children, the elderly, those living with disabilities, for all of us who need health care to be funded in order to thrive in this world. We ask that we, Lord, through your help, could support our hospitals and nursing homes, places of care, so that they have the staffing and resources they need to provide quality care. Let us look to live in a way that recognizes our responsibility in relationship. Fill us with compassion and a thirst for justice so that we may become aware that we belong to each other. Be with the hungry, the starving, the naked, the sick, and those abandoned. Be with those who serve us as healthcare providers. Give them renewed conviction in their life-giving ministry and increased wisdom to treat the whole person. Grant our lawmakers the wisdom and courage to uphold human rights for those in need of healing and help them resist the pressure to become collaborators in the culture of neglect and greed. Lord, give us strength. Give us strength to be bold and joyful witnesses to the truth that every human life is sacred. In your goodness, guard our freedom to live out our faith and to follow you in all that we do as we stand with the suffering together. Amen.
Is this working?
Yeah.
All right. And next, I'd like to welcome Shirley Wilcox, occupational therapist and CWA member, as well as Corey Gambini, president of CWA Local 1168.
Hi, everyone. As I said, my name is Corey Gambini, and I'm a proud registered nurse and president for CWA Local 1168. I've been advocating for my career, for a long career, for healthcare workers in Western New York, but my biggest membership comes out of Kaleida Health. In the aftermath of this mass exodus of healthcare in 2021, when we went through the COVID pandemic, we stepped up to rebuild. We're not quite there yet, but we have been rebuilding, adding compassionate staff and restoring essential services for our community. But the recent Medicaid cuts threaten everything we've worked so hard for. We've seen unacceptable rollbacks, including devastating cuts to our medical rehabilitation unit, as well as the closure of vital rehabilitation clinics and the family planning clinic. And there's more to come. This is why it's crucial for New York State to step up now. We need the state budget to secure these vital services, ensuring that we remain open and accessible for the people of Western New York. Today, I stand beside Shirley Wilcox, a dedicated occupational therapist who has championed the medical rehab unit at Kaleida Health for years. Together, we embody the spirit of those who provide the essential care. Our members are not just workers. We are passionate advocates for our patients and the dignity of services that they deserve. Let us unite and fight for our community, for our patients, and for services we all rely on. Together, we can make our voices heard, and we will win. Shirley?
Thank you.
I've been an OT at Buffalo General for 35 years, mostly on the MRU. I became a therapist to help people get better after an illness or injury, and I have been blessed to be surrounded by coworkers who have the same mindset. Most of my coworkers have been in rehab for more than 20 years. We treat twice as many stroke patients as the regional and national average, and we still get more of those patients discharged to home than the regional and national average. The sheer volume of patients coming through our MRU has given us the opportunity to become such an effective rehab team. A lot of times, all 34 beds on our unit are full, and there's a waiting list of patients on other medical floors waiting to come down to the rehab. Our average census last year was 26 patients. But now, because of financial concerns, Kaleida plans to cut our rehab beds down to just 16. This is insufficient for the needs of our patients. It doesn't help advance the health of our community, and it will be dangerous for these medically involved patients who will be forced to leave the close medical monitoring that they get on our MRU to go to an outlying rehab facility. Funding needs to be found to help keep our beds open, keep our patients safe. Let us do our jobs to get these patients back to their families and back to their lives. Thank you.
Thank you, and I'd like to introduce Cheryl Marino, 1199 SCIU Administrative Organizer.
Good afternoon, everyone. I'm going to start by saying the following, and that is that this is our community's issue, whatever your political affiliation. Healthcare and the need for it will and has probably impacted everybody in this room, everyone who will be watching on the news this afternoon, and anyone, because we all at some point in our lives have to use healthcare. Medicaid cuts have serious consequences for hospitals, their services, and their access to care. For example, in Congressman Langworthy's district, 193,000 people rely on Medicaid, and of those, 58,300 are children, and 22,600 are senior citizens. In that district, 23, there are 11 hospitals, 5 of which are safety net hospitals. Some of these hospitals are Brooks Memorial, who I have the pleasure of representing the members there, Cuba, and Olean General, just to name a few. Medicaid covers millions of families, children, seniors, and those individuals with disabilities. The fact is, when funding is reduced, hospitals receive less reimbursement for treating those very patients. The financial pressures force hospitals to cut services or even close certain departments like maternity wards, which happened at Brooks Memorial, mental health programs, and other rural hospitals. All this we are already experiencing, and you heard a few speak about today, and I'm sure there are other speakers this afternoon that will talk about what other devastation it's caused to the facilities. For patients, this means longer waiting times. Fewer specialists are available, and in some cases, having to travel much farther to receive care. I know when we closed TLC in Lakeshore on Irving, we not only devastated the community there, but people have to travel. And if anybody has traveled down Route 5, Route 60 in the middle of winter, when a snowstorm is pending, what takes 20, 40, 60 minutes now is doubled, tripled, and sometimes you don't even know if you can get through. So that has affected, I'm sure, people's lives, and I'm sure has caused some deaths because minutes matter. Rural and community hospitals are also vulnerable because they rely heavily on the Medicaid payments to stay open. Ultimately, Medicaid cuts just don't affect insurance coverage. They weaken the entire healthcare system. When hospitals lose resources, access to care declines, and the most vulnerable patients face the greatest barriers, getting the treatment they need and the treatment they deserve. I'm going to leave you with this quote. When our rural hospitals across Western New York close their doors because of drastic Medicaid cuts, it's not just the buildings that become vacant and dark. It's communities and families losing their lifeline to access healthcare, and the most vulnerable paying the highest price in inhumane political decisions. Thank you.
Thank you, Cheryl. Next, I'd like to introduce Jen Williams, a registered nurse at Mercy Hospital on behalf of CWA.
Good afternoon. My name is Jennifer Williams, and I am a registered nurse at Mercy Hospital Buffalo, part of the Catholic Health System. I work as an EMR nurse educator and have worked at Mercy Hospital for 18 years. In addition to my work as an RN, I also serve as the union staffing director for our clinical staffing committee. As New York State budget negotiations move forward, critical health care funding is on the line. All New Yorkers, and especially those of us in Western New York, are facing devastating consequences as a result of HR 1. For those of us at Mercy Hospital and in the Catholic Health System, we will feel the effects of the strain that is placed on the hospital. It will worsen short staffing in our hospitals, which will directly impact the care we deliver to our patients. When positions go unfilled, the workload increases. The burnout of healthcare workers increase, and as a result, an increase in turnover rate of nurses and healthcare workers leaving the bedside, worsening the staffing shortage that already exists. Patients will wait longer, resulting in delay of care, and complications will increase, which will have a direct impact on the health of our community, putting their lives at risk. Corporate greed has put a price tag on a patient's life and the safety of our healthcare workers in Western New York. Our leaders in Albany have the power and the money to step up and protect our healthcare system, our patients, and our healthcare workers. We are calling on New York State to increase Medicaid funding in this year's budget to protect safe staffing and patient care. They must hear our voices raised in a unifying cry to do the right thing. Fill the hole left by the federal Medicaid cuts. Thank you.
Next, I'd like to introduce Dr. Stephen Turkovich, President of Golisano Children's Hospital of Buffalo.
Good afternoon, everyone, and thank you all for coming to stand up for Medicaid. I'm Dr. Stephen Turkovich, the president at Golisano Children's Hospital of Buffalo. As a father, a pediatrician, and president of our community's children's hospital, it is a privilege and an honor to serve the kids and families of Western New York who need us the most. Last week, we had the honor of hosting Dr. Andy Racine, the president of the American Academy of Pediatrics. And this is how we describe Medicaid from the lens of children's health. There is not a single thing in the United States that has to do with the delivery of pediatric care that is not dependent upon Medicaid, not just for the children that are in the program, but children that are not in the program. Medicaid undergirds all pediatric care in the United States. This is especially true here in Buffalo, where over 60% of our patients at Golisano Children's Hospital of Buffalo are enrolled in Medicaid. In fact, our hospital has the largest percentage of patients enrolled in Medicaid compared to any hospital in all of New York State. In Western New York, over 140,000 children are enrolled in Medicaid. So Medicaid not only is critical in sustaining the services and the team at Children's Hospital, it is also vital to all the pediatricians in our community. In fact, on average, 35% of a pediatrician's patient panel is covered by Medicaid, the highest of any medical specialty. As we know, the medical, social, mental health, and economic challenges facing the families in our community continues to grow. Here in the city of Buffalo, nearly 40% of our children live in poverty. That's 2 out of every 5 children. In Western New York, there are more than 16,000 children with a disability, the vast majority of whom rely on the support and services funded by Medicaid. These children are our neighbors, our friends, and family members whose health and well-being are directly impacted by the effects of poverty. These children are also our patients. As the only children's safety net hospital in Western New York, our team of dedicated healthcare workers care for over 15,000 patients admitted every year. In addition, annually, we provide care for more than 47,000 visits to our emergency room, 110,000 visits to our primary care and specialty clinics, and 10,000 visits to our pediatric mental and behavioral health center. We cannot do this great work without the support of our elected officials, partners in organized labor, and community leaders. They have recognized that Medicaid is a wise, high-yield public investment in our future generations. Medicaid is a young pregnant woman seeking prenatal care so that she can carry her baby to full term and have a safe birth and a healthy baby. Medicaid helps to hire the social worker who links her to transportation to and from her appointments. Medicaid is a 2-year-old who is screened positive for lead poisoning from the lead paint in the house that they rent. Medicaid is providing them the treatment to rid their body of the toxic effects of lead. Medicaid is a 5-year-old getting ready for kindergarten who needs glasses to see their teacher and vaccines to protect them from the measles and the flu. Medicaid is an 8-year-old struggling in gym class due to exercise-induced asthma. Medicaid funds the life-saving asthma treatments and supports the hiring of asthma educators to teach them how to best control their symptoms and keep them out of the emergency room and out of the hospital. Medicaid is a 10-year-old who was riding their bike in their neighborhood and got struck by a car. Medicaid helps to fund the trauma team of doctors, nurses, and therapists who are ready 24/7, 365 to save their life and help them heal from their physical and psychological injuries. Medicaid is a 14-year-old who is being bullied in school and has feelings of depression and thoughts of suicide. Medicaid funds a mental health team that helps to heal those invisible mental and psychological wounds. Children with Medicaid coverage show improved academic performance with higher reading test scores, higher high school graduation rates, and increased college enrollment. They achieve higher wages as adults and have fewer preventable hospitalizations later in life due to lower rates of hypertension, diabetes, heart disease, and obesity in adulthood. Mothers who had Medicaid as an infant give birth to healthier children today, showing the multi-generational impact of Medicaid. And Medicaid saves lives. A 10% point increase in childhood Medicaid eligibility is associated with a 3% decline in child mortality. For Black children, early eligibility reduced mortality by 13 to 20%. Studies have shown that for every dollar spent on childhood Medicaid, almost $13 is generated in total societal benefits. For the government, projections show that for every dollar spent on children, it saves $4 in future costs due to reduced disability and higher employment up to 50 years later. The investment Governor Hochul is making in New York hospitals and nursing homes is nothing short of remarkable. Her executive budget recognizes the historically low Medicaid reimbursement by increasing outpatient rates by 10%. Additionally, she is adding billions to support capital and operational needs of hospitals and nursing homes. Thank you, Governor Hochul. But unfortunately, as wonderful as all of that is, it is still not enough. As I look around today and see our friends and partners in state government, we need your help. Please work with us to restore the $520 million that were cut from the Vital Access Provider Assurance Program, or VAPAP. This program is designed to assist safety net facilities, and there's no more important than the safety net facility in Western New York, that is Golisano Children's Hospital of Buffalo. The tremendous investments being made by the governor will provide the fiscal base New York State needs as we continue through the federally mandated Medicaid changes. There's no easy way to say this. As Medicaid eligibility becomes stricter, people with will lose their benefits, which will put a strain on the entire healthcare system, but will acutely be felt by safety net providers like Children's Hospital. Governor Hochul and our state representatives have our backs. I, along with my colleagues at Kaleida Health, stand committed to working with our elected officials, labor and community leaders to ensure the needed and necessary services to all Western New York patients are accessible and available. Together, we can make the necessary investments in our children that will enable them to grow, thrive, and achieve their greatest potential. Thank you.
Thank you, Ms. And now I would like to introduce everybody, although she doesn't need an introduction, to our New York State Assembly Majority Leader, Crystal Peoples-Stokes.
Thank you. I just listened to all of the reasons why we have the wrong administration in Washington. All of the reasons why, for whatever reason, many of us, and even some of us in this room, didn't put our maximum effort in on the 2024 elections. Well, the 2026 elections are coming. And if you think that the state of New York is not going to be engaged in trying to help sure that we mitigate these cuts to its impacts on our people that live in New York State, then you don't understand New York State. Because as was already said, the governor stepped up in her budget. We have not even completed our portion of the budget yet, so we're going to step up. But what we need is for the citizenry to step up when it's time to elect people. Because quite honestly, we really shouldn't even be here. But some people chose, for whatever reason, they weren't concerned about Medicaid. They weren't concerned about the environment. They weren't concerned about affordability. They were concerned about some myth, quite frankly, that doesn't even exist in most communities. Public safety, criminal justice issues. Most of the places that need to vote in the right place, like where Mr. Langworthy represents and where Ms. Tenney represents, they don't have crime problems. But that's all they want to talk about, because they know that frightens the voters, scares people away from voting for people who might have their best interests at heart. I can assure you that there are not many Democrats who don't have your best interests at heart. In fact, some of them who lived in North Carolina that didn't have the best interests of their people at heart lost their primaries last night by big numbers. So the solution to most of all of our problems is not just give me more money because you need it right now. It's setting up a system that allows us to always be able to take care of our people. You will note that your federal representative now is running all over the country, all over the world, doing things for other people who already have access to universal health care. We don't have that. We're the only industrialized country in the world that doesn't have a way to make sure that all of our constituency always have access to health care. And so instead of getting that, we're getting a person in place who wants to cut those benefits. Now listen to the president from Children's Oishei Hospital. Great comments. The only thing he didn't mention is Medicaid is also seniors. Medicaid is also nursing homes. All of that is Medicaid. And so the fact that there's some desire to cut it says some people don't care about us. And we got to stop caring about negative rhetoric and all these campaigns that they run against people of color, against immigrants, about public safety in communities where they don't even have to deal with the issue. But they always want to set up problems for people who do have to deal with the issue. So I just need us to be awake all the time. Somebody get concerned about the term woke. Well, what happened when we went to sleep? Look what happened when we went to sleep. We were convinced to go to sleep. We were convinced to think about some other things, and we slept on it. Well, we can't sleep on it anymore at all. I don't know who lives in Langworthy's district. Quite frankly, I don't care if you live in this district. You need to call them anyway. I don't know who lives in Teeny's district, but you need to call her. We're grateful that we have Senator Kennedy in our district. He's going to take care of us. We're not going to worry about that. But we do have to make sure that the other communities understand that they have to worry about it. Rural hospitals, urban hospitals, community health centers, organized labor, everybody has been brought to the table by this delegation. We've met with them all individually. And we're still working on trying to see what can we do besides add additional dollars through our budget process to bring the cost of delivering healthcare down. People like to talk about fraud. There is a lot of fraud in healthcare, but I don't see it. I just left ECMC, by the way, for some testing that I had to do. I don't see fraud. I see people delivering service. I see workers working hard. And when I go to Albany and these conversations come up, I still see you. I know what your issues are, but I need you to understand mine. And I need you to understand my issues and the issues of my people that have been being used and criminalized instead of added to the value of our society. I think we have to start now. And it's way beyond just organized labor. It's your neighbors who are not in labor. It's your church members. It's the people who work in your children's school systems. It's people who work in community centers. Everybody has to be engaged. There's no room to leave anybody out. If we ever do this again in life, we're done. So we got 26 coming up, and I hate to keep sounding political, but that's the reality of where we at in this world. You know, you want things to happen politically, you got to be engaged in it 100%. So thank you, and hope for all the best for us.
Thank you, Majority Leader. And now I'd like to introduce everybody to Ebony Rose, who is the ECMC Section President for CSEA.
Good afternoon, everyone. My name is Ebony Rose, and I am the CSEA ECMC Section President. Today, I'm speaking on behalf of the members of our unit who work at ECMC here in Buffalo. Our members are proud to care for this community every single day. They keep ECMC running, not only caring for routine patients, but also the most vulnerable patients, providing social services support and ensuring that the hospital operates safely and effectively. But ECMC is already under serious strain. The hospital has been facing significant financial pressures and layoffs, all while continuing to serve some of the most vulnerable patients in Western New York. Many of those patients rely on Medicaid for their care. When Medicaid is underfunded, hospitals like ECMC feel the impact immediately. It means fewer resources. It means increased pressure on staff who are already stretched thin, and ultimately, it threatens access to care for people who need it the most. ECMC is a safety net hospital. Our members care for every person who walks through those doors. But when Medicaid reimburses hospitals far below the actual cost of care, especially here in Western New York, it puts the entire healthcare system at risk. Our members will always show up for this community. We urge you to increase Medicaid funding in New York's budget to help protect hospitals like ECMC from devastating federal cuts and to ensure that our community continues to receive the care it deserves. Thank you.
Next, we have Lana Denisko from NYSNA, an RN at ECMC.
I'm going to tell you not what I think. I'm going to tell you what I know. While elected leaders, exceptions to the rule, while elected leaders protect the 1%, our public sector facilities laid off 150 workers at ECMC, further widening the safe staffing and also the continuity of care and compromising patient safety. While elected leaders, exceptions to the rule, like Langsworthy, refuse to tax ultra-wealthy corporations, our communities and our ERs are flooded with people for basic needs, housing, food, prescriptions that they can't afford because Medicaid no longer covers it, cutting their scripts in half because they can't take the full dose because it runs out before they can refill them. Congressman Langworthy, shame on you. Shame on you, shame on you. There's 30 billion in reserve funds. Start spreading that to ensure that your constituents have access to equitable health care. Rural areas, impoverished areas, Chautauqua County, Brooks Hospital, Olean General. Shame on you, Langworthy. 1.2 billion utilized for managed care that profits. They profit from what they deliver. Spread that 1.2 million. Spread that towards the safety net hospitals that protect our communities and keep them safe. You have a budget when you should have a moral obligation to the people that elected you. Repeal the Medicaid cap. Match the federal funds for Medicaid reimbursement for public sector. Enforce the safe staffing law. Shame on you, Congressman Langworthy. In the words of my very respected colleague, John Batson, your goals are generational wealth. Our goals are generational health. Do what's right.
Ivana, now I'd like to introduce everybody to Senator April Baskin.
Good morning, friends. I want to thank 1199 SEIU and your leadership for organizing today. It's organized labor that has been not just the backbone of change in this country, but the driving force of policy that makes people's lives better in this country. And I appreciate all of our frontline healthcare workers and our working families that are represented here today. And I especially want to thank those that have been fighting throughout COVID, throughout this transition of leadership, both locally in elected office and at a federal level. I know it's taxing, but you get up every single day and you keep doing the work and it doesn't go unseen. And a lot of days when I feel like I can't do the work, I look at you all and I know that I can. So give yourselves a round of applause, please. As Majority Leader Peoples-Stokes said, I'm sorry, I have a bit of a sinus infection. I can't hear if I'm talking. Can you guys hear me? Yeah. My hearing is so bad today. I'm not too loud though, right? Okay. As the Majority Leader said, you know, I don't really like to harp on politics a lot, on issues that pertain to humanity, but this is just such an overt drive of what the consequence of poor politics has on our community. And people, especially in Albany, keep saying healthcare is not a partisan issue. Healthcare is not a partisan issue, but it certainly seems like it is. Everybody that put us in this position is from a specific side of the aisle. And even here today, when I look around the room at the representatives from the Western New York delegation, our partners in county government, Legislator Dupree, our comptroller, Kevin Hardwick, I see the Democratic leadership that is here today. And so it's hard to have these types of conversations about how we need to vote and what we need to do as voters. But if we are dishonest with ourselves or live in a way that we're not being forthright, we're going to keep hurting ourselves, and we are a part of the problem. I was in the top supermarket on Jefferson this past week, and I ran into this lady. She's so sweet. She's got the cutest name. Her name is Mary Berry. And it's funny, she lives in the Fruit Belt. And and Miss, so I always call her Mary Berry from the Fruit Belt. And I always say, we need a Berry Street in the Fruit Belt, Miss Mary. And I get tongue tied like a Dr. Seuss book, but she just loves it. And she said, Senator, I hope you and the governor are working hard to help us with this healthcare system, because I had an awful dream. I had an awful dream. And I said, you know what? I assumed that she was going to tell me a dream about May 14th and the mass shooting. But she said it's just as traumatic. She said, I woke up and I went, her dream was she woke up, she went to the pharmacy to get her medicine, and the federal government had taken medicine from every single American. And there were no doctors and there were no nurses. And when she left the pharmacy, she collapsed in her dream in the parking lot and she died. And I said, oh, Miss Mary Berry. I said, that is an awful, awful, awful nightmare. It's not a dream, it's a nightmare. And I hate to tell you this, but it's not that far from reality. It's definitely the way that this country is trending if we don't all continue to work together and do what we need to do to prevent our most vulnerable, or all Americans, from facing their demise. And we've already felt these strains here at home with Kaleida Healthcare cutting services, with the closing of healthcare centers, with Erie County Medical Center cutting and laying off workers. And we know that these cuts, they don't fall evenly. It's not like it falls on everybody. Somehow, some way, it will eventually. But when it first shakes out, it shakes out to those who can't help themselves first. Working families, communities of color, children, our residents with different abilities, and older New Yorkers, all who rely most on Medicaid. These are our most vulnerable communities, and they are always the first ones hit. And when it hits them the hardest. So now it is upon us. We must continue to organize. And those of us who hold elected positions, we have to find a way to push ourselves to fill that $2 billion gap in Washington created on New York's healthcare system. And we must protect our hospitals, our nursing homes, and our healthcare workers, and our neighbors who rely on Medicaid. Healthcare is a human right. It should not depend on your zip code, your income, your age, or your skin color. And without access to Medicaid, New Yorkers will die, just like Miss Mary Berry's dream. So I am here to tell you all that as I drive up and down the 90 every single week, negotiating the one house and eventually negotiating the outcomes of this state budget, that these priorities are deep in our hearts. And I stand with you as we push those who are elected to hold position currently, hopefully not too long in Washington, to wake up before Miss Mary's dream becomes far too true. God bless you all. I stand with you. Thank you for having me today.
Next, I'd like to introduce Senator Jeremy Zellner.
Is somebody's phone here? Oh.
I got that.
Oh, good. There's a gambling app open on it, so. How's everyone doing this morning? Afternoon. I want to thank you, first of all, for all of your advocacy and work. And I want to just ask you one question. Have you had enough? Have you had enough of what's coming from Washington? I want to thank the majority leader for injecting politics. Who would have thought it would have been her that did that in this speech? But she's absolutely right. There's only so much that we can do at the state level when more than $1 trillion has been cut out of healthcare across this country. $1 trillion, so that we can give rich people more money. It's killing people. It's hurting our community. You're hearing from these folks, their stories that are right down the street that are happened to our neighbors and our people here. So I was told I only have 2 minutes, so I think I'm on about 1:10 right now. But what I would say is the time to act is now. Yesterday, we were in Albany, met with legislative leaders from 1199 to talk about Home Care Savings and Reinvestment Act, which I'm going to sponsor that bill in the Senate as soon as we get rolling with that. But today, now is when we need to stand clear and send a message that we will not be left behind, that we are going to fund Medicaid, and we are going to send a message this November. Did anybody listen to that speech a couple weeks ago? We need to elect Hakeem Jeffries so he can tell this guy next time, just send us a letter. Don't come over here and have a grandstand. We just want you to send us a letter like you're supposed to, because we've all had enough of this and we've got to push back, and the time is now. Thank you for what you're doing. Keep standing strong.
Next, I'd like to introduce the administrator from Sholkoff Nursing Home, Marisa Prokop.
Good afternoon. My name is Marisa Prokop. I am the administrator of Sholkoff Health Center, the non-for-profit nursing home attached to Niagara Falls Memorial Medical Center. Nursing homes are a critical part of the healthcare system, and we care for some of the most vulnerable people in our community. At Sholkoff, we often admit residents who arrive with no family support, no clear way to pay for long-term care. Our staff not only provide the daily care these residents need, but also the sense of stability, dignity, and a connection that every person deserves. The relationships they build with the residents are grounded in compassion, respect, and a genuine commitment to quality care. Our LPNs and CNAs are the backbone of that work. They treat residents like their own because they truly care. Last year, Sholkoff made a significant investment in our union contract so we could offer the strongest wages possible. We believe that when we invest in our staff, in fair pay, in training, and in stability, we strengthen the quality of care our residents receive. But we also have to acknowledge the reality we're all facing. Nursing homes across New York State have been chronically underfunded for years, and that hasn't changed. The people we serve can no longer remain safely at home. They rely on facilities like ours to exist, to provide medical, personal, emotional support they cannot get anywhere else. Adequate Medicaid funding is essential if nursing homes are going to survive, retain staff, and continue serving their communities. Facilities like Sholkoff cannot fulfill our mission without a reimbursement system that reflects the true cost of care and the value of the workforce delivering it. Our residents depend on us. Our staff deserve the resources and stability to continue doing this work. Our community deserves a nursing home system that is strong, sustainable, and funded at a level that matches the care we provide every day. Thank you.
Thank you. Now I'd like to ask Shannon Carter to introduce herself.
Good afternoon. My name is Shannon Carter, and I would like to thank you for this opportunity to speak about my family and how the current Medicaid services have affected our lives. As a foster care and adoptive parent, I would not have been able to give back to the community and to give love to the children who truly need it without these services. As a single working parent, I am able to afford medical insurance for myself. But with the cost of insurance, I would have never been able to afford to pay for insurance or for the services that my children needed in order to thrive. I have guardianship of one, and I have adopted another daughter, and they both came to me with severe emotional problems due to childhood trauma that no child should have to endure. Without the counseling and extreme mental health care that they needed, I would not have been able to raise them to be the beautiful and productive citizens that they are becoming today. It is because of Medicaid and the financial services that they received that I was able to get them the intense mental and crisis services that they needed. If foster care and adoptive parents are going to continue to take these children into loving homes, they must have the support and assistance of Medicaid and the services that it provides. As a foster and adoptive mother, I would like to ask our elected officials, please fund healthcare so that my children and other families can continue to get the critical care and services that they need. Thank you again for this opportunity.
Thank you, Shannon. Next, I'd like to introduce Assemblyman John Rivera.
Good afternoon, everyone. I want to first thank somebody in the room who, there's a little known fact about this person and his real hard-earned and legit commitment to healthcare, and that's Controller Kevin Hardwick. There is an interesting fact that not too many people know about the Controller. And that is, years ago, before I had these grays, I worked in county government along with then legislator Pat Burke. And I don't know if many people remember a guy named Chris Collins. But he left our county in a rough shape in a lot of different ways. And at the time, the legislature, the majority was Republican. And it was my job at the moment to go to the legislature on behalf of the county executive and try to get things done. And one of the biggest challenges we had was ECMC. And we know that Chris Collins, in the line of what we're talking about, where Republicans value healthcare and access to healthcare, really made everything possibly worse. And we're in a tough position, and we needed 6 votes to be able to fund the necessary improvements at ECMC, $100 million. And we fought to try to get it done, but that majority pushed back along the way. One person in the majority that was of level mind, that was of compassionate heart, changed the position from what the majority was. That was Kevin Hardwick. We wouldn't have that $100 million in the new improvements at ECMC if it wasn't for Kevin Hardwick. So I want to thank you for it. I'll just echo the very first person who spoke up here with Todd, and he said that this is sort of twofold. It is that we cannot stop pushing for change out of Washington. We cannot give up that fight. We cannot let them go. A few months ago, I had the good pleasure of hosting 2 town hall meetings with 1199 in my district. One in Riverside, community represented by Tim Kennedy, and one in Hamburg, a community represented by Nick Langworthy. Guess which one had more people? The one with Nick Langworthy in Hamburg. So what happens? Every constituent that comes up, and I know they're of a different party affiliation than me, and I know that they probably don't know me all that well, but every single one of them, I've tried to call the congressman, I can't get a call back. I'm trying to let them know how I feel about this, can't get a call back. All we get told is he's doing his thing and this is happening, and we can't, nothing. In 5 years of representing Hamburg, I don't think I've seen Nick Langworthy once. So here we are in this horrendous situation fully brought on upon us, not because we have to tighten our belts, not because we're facing some sort of issue of federal debt. No, it's because people are making choices, burdening the working class and taking the most from those who have the least. For no other reason other than because they can, and because they're punitive, and because they're angry, and because they see this country changing in a way that they don't like. So they will fight us along the way to whatever version of progress favors us. And here we are today, and I'll say this now. Yes, Todd was right. We have to fight this fight against this House, and we're hopeful that next election is going to look different. But what we're going to do in the state legislature is easy. We are going to, in response to what's happening in Washington, where people are moving in reckless indifference and coldness and inhumane brutality, we are going to move in compassion and with justice and with righteousness and with love and compassion and empathy for those that elected us and for those that we call our families and our neighbors. So we are going to fight for every dime we can to come into this and fix this problem and do what is right. So thank you very much.
Thank you. I would like to introduce Assemblyman Bill Conrad.
I have to ask the question, Mr. Hardwick, was that after I ran against you? Did I pressure you? I moved you. So what does that say? Elections have consequences, and running people also does as well. I have to say that all of our colleagues and friends in this room have really echoed every instance of issue with this. I can't help but think of an Annie DeFranco song when I was teaching economics, and it was called, "They Told Us It Was All Going to Trickle Down." Has it trickled down to you? Because it hasn't trickled down to me. I left this morning and my mother-in-law lives with me. I know, saint. And I left her, but she's 81 and she's she's not doing hot, you know, she's pretty limited in what she can do. And all she has is her Social Security, and all she has is her Medicare or Medicaid. And, you know, I talk about, you know, things that are going on in the world. Of course, she's watching Fox News, but I threatened if you don't get up and do something, I'm going to turn it off at the box. But anyway, but I get to the point that she's like, well, where are you going? I said, I'm going to go fight for you. And she appreciated that fight. But, you know, without Medicaid, her medicine bills take up 3/4 of her Social Security check. If it wasn't for our ability to take care of her in our home, she wouldn't be able to take care of herself. And if that's me, what is going on across Erie County and the rest of this country? It's a shame. I've heard the words inhumane. I've heard the things that we need to say, but you know, talk is cheap. Let's walk the walk. Let's do our part. And I'm happy to be here and support the folks that are in this room, and I'll do my fair share, and we will show it in our one house. We will show it through the governor, and we'll show it through the Senate and all of our partners. And I thank every one of you in this room for the work you're doing. So thank you.
Thank you. And now we have Assemblyman Pat Burke.
Thank you, everyone. I remember, being a county legislator with Kevin Hardwick. I'm glad you gave him a shout out. Because John used to work for me way back when. But he makes the point that Kevin Hardwick at the time was the only Republican of conscience doing the right thing in the county legislature. But the only Republican of conscience in the county legislature doing the right thing, what party do you belong to now? He's a Democrat, right? It was a different world. And so we've talked about the political nature. We don't want to get political. It's really political to not tell the truth about what's happening. What party controls the House of Representatives? What party controls the Senate? What party controls the presidency? What party controls the Supreme Court and makes it a very political Supreme Court? That's where we're at. I don't know how we're at that place where the group that prioritizes every day empowering rich people and injuring poor people, injuring working class people, now has every part of control of the federal government. But that is where we're at. And if we don't say it and we don't point the finger at it, we are lying to ourselves. We are lying to everyone. Like this thing, like, man, I really hate politicians. I'm a politician. I hate politicians too. Everyone hates politicians. It's an easy thing to say. It's an easy thing to say, but it broadens it too broadly. It's all sides. Everyone's a problem. No, there's a very specific problem. It is broken in this country. We opened today with a prayer. The Republican Party is supposed to be the conservative Christian party, the highly religious party. I grew up very Catholic. My grandma, Irene Burke, was the most important people in my life. We would sit and have tea almost every day together. She's a very religious woman. The Beatitudes were hanging on her wall in the kitchen. The Sermon on the Mount affected us. I don't recall it being blessed are the powerful, blessed are the rich, blessed are the politically connected. But the religious party in this country, the Christian party, is the least Christ-like group of people I've ever encountered in my life. And my grandma always had a saying, and I don't know if it's a common saying, I attribute it to her, but we went to church all the time. But it was a reminder, you can't just go to church. You can't sing the hymns and say the prayers and not do the stuff. So it was, correct, you might know it. Charlie went to church every single Sunday. Charlie went to hell for what he did on Monday. And so remember, and thank you, Grandma Burke. Thank you, Grandma Burke, for always reminding me. It is what you do every day. Is how you treat the people, the least of us. This group of people wakes up every day thinking of how they can screw over poor people so their rich benefactors can get more. Like, what type of life is that? It's certainly not a Christian one, even though they want to claim it. So we have to identify it. And the majority leader pointed it out, I think, very clearly. This is a time to be exactly political and not be apologetic about it, because people's lives are on the line. 50% of children who are eligible for Medicaid are going to lose their health care. That means some of those children are going to die. To not be apoplectic about what that means is to be less than human. Like it's unconscionable where we're at. So today is a solemn day to come here and talk about this stuff. It's really friggin' sad that we're here doing this. But I want you to know my colleagues are in this fight. I have a lot of faith in them. And I wanted to point out one thing. Even in politics, you know, even in Democratic circles, you don't always get along. Some people are fighting for the same stuff. Some people, there's interpersonal stuff. I never doubt whether these people believe in the right things and want the right things. You can be cynical about politicians. Again, I often am. But understand these are generally decent people whose eyes do wake up in the morning trying to figure out how they're going to make other people's lives better. So thank you all for being here. Happy to fight.
Next, I'm going to introduce Todd Barber, a member of Voice Buffalo Disability Social Justice Program. Todd, I have this mic for you. I'll bring it over. But before I do that, I did want to just share with everybody that both Langworthy and Tenney were invited to attend this press conference and to meet with folks in this coalition, and we did not hear back from either campaign office.
Okay. So I just want to make sure if the media in the back can hear me, because I'm not next to your microphones. Thank you. Guys, in my day job, I would refer to myself as the loyal opposition to organized labor. In my day job, I help people with disabilities stay independent in the community. That means that I want to keep them out of nursing homes and hospitals for as long as they can be out. And the true nature of this crisis is about the fact the advocates and organized labor agree. Because not for nothing, I am Medicaid. From the chair you see me sit in, to the person who got me dressed to come to work this morning, to the services that I need to stay safe in my home so that I'm not charging the county $124,000 per person per year. But I'm also a product of everything you heard about today. A physical therapist, an occupational therapist, nurses aplenty. I have a soft spot in my heart for healthcare workers. I wouldn't be the advocate I am without them. So what happens to the person that follows me, that doesn't get access to that care, that doesn't get access to that service, that doesn't get access to that social worker that ties them to what they need? Do you know what happens to them? They end up in nursing homes, costing you money. They end up in prison, costing you money. This is how bad the crisis is. And I'm not talking political. I'm not talking about who's responsible. I'm talking about what is. Because I'm standing here today because 4 other disabled people couldn't get the transportation from their home to get here to give this speech. Disability services are Medicaid, and they are under attack because, trust me, we've taken it on the chin. And one of the reasons I'm here today is because one of the biggest things we took it on the chin for, SEIU stood up for us. So if you stand up for us, I will stand up for you, because that's the way it works in the real world. That's it.
Next, we'll hear from Tori Henley from the VNA and on behalf of CWA.
Good afternoon, everybody. My name is Tori Henley. I work for the Visiting Nurse Association, and I'm a licensed practical nurse. Home health nursing is one of the most cost-effective things that we can offer patients to save money for our health system. Study after study shows that skilled home health care reduces hospitalizations, shortens your recovery time, and keeps you out of nursing facilities. Every dollar cut from home health service has a multiplying effect on our patients. More ER visits, more inpatient stays, and long-term placements that there are no place for them. Our social workers and clinicians see firsthand how Medicaid decisions plays out in everyday life. These aren't policy changes to us. They affect when someone can safely stay in their home, have access to food, or help manage their medications. When you are trying to make something out of very little in reductions in funding that came from this federal level, it reduces case management, support services. We see this on a daily basis with vulnerable people. What concerns us the most is the risk of more people falling through the cracks. Good outcomes depend on advocacy, coordination, follow through. When the system is stretched this thin, those pieces become harder to maintain, and the families and the patients feel that. We meet people every day who try their best to remain independent, and they're overwhelmed. People don't ask for luxury, they ask for their basic needs to be met. Those of us in home care are committed to our patients, to our community, and to our neighbors. But the reality is fewer resources create real gaps in care. Without strong home, community-based support, we're seeing higher stress and we're not able to prevent these rehospitalizations or just unmet basic needs. This is why we're calling on New York State to make sure they can help close this funded gap that was created by the federal government to help our patients, your families, and our community. Thank you.
Sorry, next I'd like to ask Heather Benz, who is a licensed practical nurse at one of our nursing homes, to speak.
Good afternoon, all. My name is Heather, and I am a licensed practical nurse in one of the local nursing homes. And I have been an LPN for 10 years. And before that, I worked as a certified nursing assistant for 15 years. I spent almost 25 years of my life in the nursing field. And in all that time, it's been bedside and at long-term care facilities. And I have seen firsthand the change that's happening. Nurses and CNAs are working long hours and caring for 13 plus people. And at that time, they're taking care of people that have a broader scope of higher care needs. Medicaid reimbursement rates in Western New York cover less than 70% of the costs to provide care to our residents. These low reimbursement rates have resulted in fewer staff, less quality supplies, and the deterioration of our facilities. These low reimbursement rates cause job cuts without considering the workload. More nurses leave bedside nursing due to the burnout it causes. Our turnover rates are extremely high, and there is absolutely no positive morale. Nurses leave due to the fear of losing their license. Our patient to staff ratios continue to increase, even with more and more work being forced on us. And what are we to do as nurses? Do we just not work anymore? Do we continue to let Trump cut our jobs, cut our health care funding, cut our systems that we have put in place for our sick and elderly people? How do we continue to do our jobs when they just continue to cut and take everything away from us? Our healthcare workforce was just barely beginning to recover a multi-year pandemic. And now we're going to allow them to cause another emergency by their irreversible and devastating cuts to Medicaid. If this state fails to address the federal cuts, inadequate staffing, wages, benefits, and the difficult working conditions, I know things will only get worse. Jobs will be lost. It could truly take decades for our healthcare workforce to recover from this. And I truly fear for the future of healthcare, and so should you. Everyone will need healthcare at some point in their life. Governor Hochul and state leaders must fill the gap that is left by Trump's cuts and provide funding to protect healthcare for all New Yorkers now.
And last but not least, as president of the Western New York Area Labor Federation.
So it is me who stands between you and the door. Bear with me, please. My name is Denise Abbott, and for more than 20 years, I've been an ER nurse at DeGraff Medical Park, and I serve gladly as the Health and Safety Director for CWA Local 1168. I cannot say anything more than what you have heard. You've heard the stories, you've heard what everybody has to say. But today I am here as the president of the Western New York Area Labor Federation, the AFL-CIO, where I have the honor of representing 140 local unions and their 145,000 union members and retirees here in our union, in this region. I'm going to put the blame where the blame is, and the blame is in the Trump administration. You have heard that. Trump and his supporters in Congress have cut over $1 trillion, $1 trillion in healthcare funding for families in need. At the same time, they have rigged the tax code so that the top 1% would pay $1 trillion less in taxes. That is financial warfare by the billionaire class against the working class and against healthcare here in the United States, not just in New York State, but across this country. The Trump administration is using ICE to patrol hospitals, schools, and our neighborhoods. They are murdering our nurses, those who save countless lives. They are cutting the VA. They are cutting safety net hospitals. They're calling them domestic terrorists, and they're coming after us for exercising our First Amendment rights, just as what we are doing today, and voicing our concerns over what is happening today. They're calling people domestic terrorists for standing up for their rights. This is violent warfare by the billionaire class against the working class. And today, the Trump administration is spending $1 to $2 billion per day in a war that the American people do not support, and which began with the bombing of a girls' primary school, killing more than 150 students and staff. That is warfare by the billionaire class against the working class. Every tax break for the rich is a hospital closed in our region. Every attack on healthcare workers is an attack on our patients. And every bomb that is dropped in Iran is another family member who will die without access to healthcare. We are asking the governor to do the right thing. Do what must be done to keep all of us New Yorkers safe. Fulfill your promise to the patients and the providers of New York and protect us from these cruel, inhumane funding cuts and attacks. We need to do this. They need to step up. We have work to do. We have to put people in office who care about us, who care about our families, who care about working people, who care about keeping hospitals open, not just because it's the right thing to do, but it's the only thing that's going to save our lives, save our children's lives, save your neighbors' lives. It is absolutely what they need to do. Tax the rich and fight for the working class. They need to allocate $2 billion in this year's budget to replace what Washington took from us. It is now or never. Let's all stand up. Thank you to everybody who came here. I appreciate it. Thank you very much.
Thank you, Prez. Give a hand clap to yourselves for coming out today. So again, Maurice Brown, political coordinator, you heard 1199, but I just want to be mindful and respectful of the other labor unions that helped us out. Let's give it up for NISNA, UFCW, CWA, UAPD, that's the doctors union, CSCA, Healthcare Education Project, PEP, ASME, and of course the West New York Labor Coalition. And we also have employers. Let's give it up for the employers that have been working with it. All right. It's not just our members, but they also have funding that they need to get taken care of, and they also have family members that's gonna be affected by this. So I want to say thank you to the coalition, and then we're gonna pass it over to April for Q&A from the press. You guys did a great job. You can grab them. All right, there we go. Give it up. Appreciate you guys. Be safe, buckle up. Enjoy this Florida weather.